Now, this exercise right here is called the Lewit exercise. It's a very basic type of exercise in regards to core. Now, we don't actually show complex movements such as squats, deadlifts, or anything of that nature until we've shown this, because it mainly shows how to stabilize the abdominal area or the low back prior to adding load and doing complex motions. And in that same regard, we don't show planks or dead bugs unless we've shown this first. This would be the very bare bones way of showing how to set the core, and I'll show you right now. So we used to have people do this about a couple times a day, and say 5 to 10 minutes a day for a few weeks until they really set it into more of a habit. Now, the first thing you want to do is act like someone's going to punch you and brace really hard. Now, the area that I usually use as a gauge is you can feel them contract really firm, but also too their rib cage right here, just the bottom part of it, and if you can feel that for me, feel it right there, you can give them some feedback and say, hey, if you feel this lift up at all, then you're not setting it properly. Maggie, please go away.
Oh, Maggie.
Hey, Spot! Spot! Okay, ready again?
Yeah.
Now, after they've felt that rib cage portion, make sure they breathe as well, because the breathing is really important. Now, I always tell them to breathe really aggressively out of a straw, like they're blowing out a little tiny straw, for about 3 seconds. So I'm going to have her contract, make sure she feels this part sink in, and then breathe really aggressively out of a straw. And I'll back up so you can see her breathe, and hopefully you can hear her as well. If I'm standing on the other side of the room, I want to be able to hear them breathing. So again, the sequence is contract, breathe, 3 seconds, and then relax. Usually the progression we'll give as time goes on as well is we're going to have them contract, breathe, and then while you're breathing, I want you to move the right leg. So contract, breathe, move the right leg, up, and down. Now the thing I usually tell them is that since the breathing is about 3 seconds, your leg can move continually throughout that 3 seconds, but as soon as you're done breathing, your foot should be done moving as well. So again, it's contract, breathe, move, breathing, foot is down, and then breathing's done. So again, very basic type of core activation. We recommend it to a lot of our patients that have hip, FAI, labral tears, back pain, and so on before we start them doing rehab.